Hello, welcome everybody. I'm Dr. Stacia Alexander. I'm a licensed professional counselor and I've been in private practice for over 20 years. And now that we have come to this pandemic crisis, I am having to shift a lot of my clients to virtual sessions, and some of them do not necessarily agree with that. So I thought, hey, what do I need to do to help them understand how the virtual world works and how we can use it to our benefit during this particular time in our lives? I thought, what better way to do that than a webinar? So welcome. This is a webinar for clients. This is not for counselors. So if you're on here as a counselor, welcome to my room. Welcome to my office. I'm inviting you here as a resource for your clients, something that you can share with them on how to maximize their experience with virtual counseling and to see that it actually is a valuable tool for all of us to make sure that we maintain the continuity of care. Meaning, if you've been coming to counseling on a weekly session, let's not stop the progress that you've already made, or let's actually address the things that you're experiencing right now as you're going through this particular upheaval in your life. So welcome to this virtual classroom, or how to handle your counseling sessions. Is virtual counseling actually for you? So we're going to go through this presentation. It's not going to take long. I hope you enjoy it. I have some really good information for you. While I'm not going to actually address particular diagnoses or actual circumstances that you're experiencing, I am going to talk about the comprehensive dynamic of virtual counseling sessions and how you can make it a valuable resource for you rather than missing out on something that can actually help you deal with what you're already going through or what you're now experiencing because of the changes that we've had in our worlds internationally, not just locally. So if you'll just kind of hang out with me for some information, I'm going to show you how you can use this tool virtually through your cell phones. A lot of us have smartphones now. You can actually use your laptop for your counseling session. You can use a tablet, iPad, any type of Android tablet, and you can use your desktop. Some of us can even go back to using our desktops if you actually have a camera available to you. So we're going to talk about all of these things in the context of it being convenient. We're going to talk about how accessible it is and how it is a professional resource for you. And then at the end, if you don't already have a virtual counselor, I'm going to give you some resources where you can go online and find these counselors that actually are making some allowances to help people as much as possible during that time. So hang out with me. Let's do this and talk a little bit. If you have any questions, you're welcome to talk to me over the chat. It's open. If you don't want to talk over the chat now, you can send some questions later on, but we're going to go back to the slides and kind of talk about how is this convenient for you. Let's make it as easy as possible. Choose a space that is private. It doesn't have to be perfect. Like this room behind me, this is my office. I came into the office, nobody here, right? When you're ready for your counseling session, make sure that it's private. It doesn't have to be perfect. So we're not looking at your closet saying, oh my gosh, she has this many clothes. We're not looking at your living room. You got a basket of clothes over here, or the kids' toys are over there. We're not looking at that as a counselor. What we want to make sure of is that it's private. We want you to have a place where you can talk about the things that you would normally talk about in your session if you were to come into the office. That's fine with us that it's not perfect, but we are going to ask you, hey, are you alone? We don't want to see everybody running in the background. We don't want to hear your husband saying, what did you just tell her? None of that. We want to make sure that you have a private space for you to do your counseling. So don't be offended if your counselor says, are you alone at the beginning of that counseling session? Remember that. You also want to schedule time for your counseling, just like you do your counseling when you come into the office. You want to make sure that you have 45 to 50 minutes set aside so that you can commit to that counseling session. Don't cut yourself short. Don't ruin the process by cutting it short. Now, if something happens in the middle of the counseling session, we get that. We know you got to come off, got to make adjustments. We're all making adjustments. We understand that. But don't think that you can schedule a counseling session and go to the store and think that you're just going to sit in the parking lot for 15 minutes and that'll be your full counseling session. Don't do that to yourself. Maximize this time that you're devoting to your mental health care. And then the last one, which kind of leads us to what I was just saying about not going to the grocery store in the middle of a session, make sure that you can commit to staying in one place for the duration of that session. And the reason I say that is because when you have the flexibility of being at home, sometimes you'll think, oh, my husband's coming home in 30 minutes. I can get in 30 minutes, then I'll move into the bedroom. Or the kids are outside playing, so I can start my session while I'm at the park. We don't want you to do that. We want to make sure that you can stay in one place as much as possible while you're doing that virtual session. So just kind of be mindful of that when you're scheduling your appointments. You want to make sure that you are able to set aside a space that's private. Doesn't have to be perfect, but it's private. Schedule a time where you can spend 45 to 50 minutes and that you can stay in that place at one time. So I hope all of this is kind of making sense. It's giving you some insight into what we're looking for with your counseling session. It's going to be good. You can continue this that you're already doing. So what's the next area that we want to look at? Is it accessible? Your virtual counseling is accessible. You can use various platforms. Remember I was saying that before? You can use a laptop. You can use your smartphone. I actually use some software that once I send you the link, you can actually pull it up on your cell phone and have the session, or you can pull it up on the other areas that I was talking about, like your desktop, your tablet, and your laptop. You can use a laptop to access the counseling. The other thing you want to check is your internet connection. There's nothing like a lag during the session where we as the counselor think, what did she just say? Was that an important thing? And we ask you to repeat it and you feel some kind of way. It actually stalls the therapeutic process. So as much as possible, make sure everybody's off of the gaming because that takes up a lot of your data, or on your phone, make sure you close out all of the other apps so that you're not using your internet source. And if you're on your laptop, your desktop, if you can kind of close out everything else so that all of the internet is going to your browser for your session. You also may want to use headphones. That helps, and that will also drown out the other sounds in your house. Like I've been doing counseling virtually with a couple of people who are business owners. So they'll take some time to have a session in their office during the middle of the day rather than driving over, because that could take 2 hours out of your day. But you could have a session during your lunch hour from 12 to 1. You don't have to worry about 20 minutes to get over here, 20 minutes to get back. But if you're sitting in the office and you hear the receptionist or somebody talking in another part of the building, it's going to distract you from your counseling session. So headphones are helpful. You can put those in and it's just you and I talking. Another way that it's accessible and it makes it really easy for you, you have your notes with you. It may have been a journal that you wrote in, and may have been some things that you jotted down before. Bring them to the session. We're good with that. We don't mind you picking up a sheet of paper, looking at the paper and saying, hey, this is what I was thinking about last week. Just like you come to your virtual session prepared, your face-to-face session prepared, bring it to your virtual session. Be prepared. Bring your notes. The other thing about accessibility is, like I was telling you guys at the beginning during the introduction, it's a continuity of care. You can maintain your counseling regimen if you go ahead and do it virtually and keep it up. This is not the time to cut down what has been helpful to you in staying balanced overall in your life. Right now is not the time to cut that. So if we are devoted to maintaining the continuity of care, your virtual counseling is a help for you during this period of time. So make sure that you're focusing on what you need, what you've been needing, and what you may need to supplement while you're going through this quarantine period, or while you're working in a place that you're really nervous about, or you got kids, or you got family. All of these things are going on that people are talking about. They're fearful, they're confused. Some people are having a higher level of depressive symptoms. Those are some things that we're experiencing. And if we break off the continuity of care right now, that could be detrimental to the growth they've already had and sustaining over the next few weeks while we go through this. So be mindful of that. We're really encouraging you to keep it up. The next area for your virtual counseling session is professional. It is just as professional. There are increased number of licensed clinicians who are offering virtual counseling. This has already been an evolution in our communities. I've been offering it for 2 years now. It's just that not as many people are as comfortable with doing it, but give it a try, even for your intake session. That's what people will tell me. Well, I just want to meet you face to face first. Okay, that's fine. Come on, let's meet face to face, and then we'll see what our options are after that. But the government, and I shouldn't say the government, I know in the state of Texas and other municipalities have done this as well. They're allowing counselors to offer this virtual session within your insurance programs. That's the next bullet point. Your insurance programs are now more willing to pay for this virtual session. They're making allowances, especially during the coronavirus. So if you have this service available to you, you can use it and not be worried about not being able to use your insurance coverage or not getting a professional counselor because they're licensed. You can do your search and find it. Another thing that will cover your virtual counseling and making it as professional as possible are your health savings account and your family savings accounts, where you have that cash available to you. You can use that to pay for your session. And what will happen at that point, you'll get a bill. It's called a super bill. You'll get this bill and you'll send that to the health savings account and they'll reimburse you for the cost of your services. So again, you still have a wealth of clinicians that you can use, whether they take insurance or not. And finally, professionally, this is a valuable contribution to your overall self-care regimen. Don't neglect your self-care at this time. I know I keep saying that because I want to drum it in. You guys, you're going to sit up, eat bonbons all day. I promise you, I know I gained weight during the middle of this crisis just from eating because I'm at home and I just go to the kitchen and pick up something. So we're all going to break routine. I'm not saying that. We're going to break routine, but give your space, break routine to reset so that when you come out on the other side of this, you're just as healthy as when you went into this. And if mental health care was a component of your being balanced, this is not the time to drop that level of care for yourself. Look at your options. Okay, so next, we're looking at the resources that are available to you where you can look for some clinicians who are licensed to provide this service. Psychology Today, BetterHelp.com, Timely MD, Therapy for Black Girls. You can call your insurance company right now, maybe a longer hold, or you can go online, but they have a database of clinicians. Therapy Tribe, Talkspace. These are all websites where you can go search for a clinician that matches what you need. If you search a zip code, it will give you a list of counselors and you can filter out what you need. Do you want an African-American female? Do you want a Christian counselor? Do you want a Jewish counselor? Do you want someone who has experience with trauma or anxiety, post-traumatic stress disorder? You have that at your fingertips to ask specifically for what you need. So there's no excuse. There's no excuse. You would do this. I know we're all having fits, ladies, about our fingernails and our hair appointments and eyebrows and eyelashes. We'll take time to look into providers for that. But we need to take as much time, gentlemen, your barber, who you get to fix your car, all of these places where you want to take your clothes to be cleaned or purchase your clothes. You'll take time to look for those things, but how much time do you actually take to look for a counselor? So these are some resources available to you that you can take a look at. And then finally, I want to go over when to access a higher level of care, because virtual counseling is not the right fit for every situation as it involves mental health care. I'm not your therapist, so I can't answer. I don't know. Some of my clients may be on here. Let me say this, but everybody that's watching, I'm not your therapist. Some of you, I can't be your therapist because you know me, but I definitely have a resource bank that I can refer you to somebody if I cannot see you. But the reality is counseling, virtual counseling certainly is not appropriate for every situation. If you have a situation where your despondency is increasing, the people around you, if you see your child or you see your spouse or your mother, you call them, especially the geriatric population, if you see that they're becoming more despondent, virtual counseling may not work. We may need to get them a higher level of care. If you realize that the sleep-wake cycles are debilitating, you're going hours without sleeping, or somebody that's sleeping all the time, that's cause for concern. Suicidal ideations or attempts, that's not a virtual counseling situation. They need to get to the hospital as soon as possible. Oh, and that's kind of hard to say, but they can go to a rehabilitative or a psychiatric hospital versus the local emergency hospital, because we know that they're all taxed now with flu-like symptoms and the COVID virus symptoms. The other thing is if there's increased negative thinking, psychosis, hallucinations, delusional thinkings, if those increase, virtual counseling may be a triage option, but it's not the final treatment option. So they're going to have to get a higher level of care. And finally, increased thoughts of violence or aggression. That tells us that there's something more going on. You may triage with your counselor, but you may need a higher level of care. So I'm not saying that virtual is an end all, but neither is in-office counseling. We can't treat everybody that comes through that door in-office counseling. Sometimes we refer them to a higher level of care. So be mindful of that. We can do a lot over virtual counseling, but as licensed clinicians, we're also aware when we need to get a higher level of care. So thank you for tuning in. Here's my contact information. You are certainly more than welcome to reach out to me. My website you have there, Dr. Stacia Alexander, are most of my social media tags on Twitter, LinkedIn, Instagram, and Facebook. And then on my website is the website is www.staciaalexander.com. I appreciate you guys for tuning in for this webinar. It's been a blast. It's quiet at the office. My girlfriend laughed at me when I told her I was on my way to the office. She said, I knew it. You enjoy that quiet space so much. And I was like, well, there's nobody up here, so why shouldn't I go in? So thank you for tuning in. Please share, because this is valuable information that we certainly need in our communities right now, and helping people understand that just because we're quarantined does not mean we have to be isolated. There is help to make sure that we're getting through the different facets of this. It's financial, emotionally, cognitively, relationships. I could go on and on about the different areas of our lives that are affected by the coronavirus epidemic. Even beyond this, you have counseling at your fingertips. It's easily accessible. It's cost effective. You can do it. You cut down on gas. You cut down on time. We can do this. So reach out. Make sure that you secure a counselor for you and yours. And let's get through this together. Make sure you reach out, share this, comment. I'm answering all the questions. They come directly to my phone. You guys take care of yourself. I'm Dr. Stacia Alexander. Thank you.